Hello, I'm Elizabeth Cronin at the National Mass Violence Center, and today's SNAP program is Planning for a Mass Violence Incident, Understanding Your Community. This presentation is part of the National Mass Violence Center's MVI SNAPs, a virtual education series designed to provide brief, skills-focused presentations about an array of topics relevant to mass violence, including preparation, response, recovery, and resilience. Each SNAP will focus on 2, 3, or 4 specific objectives for takeaways. Today's SNAP webinar focuses on how important it is to understand your entire community, the different needs they may have following a mass violence incident, and what resources you have available to address those needs. We are grateful to the Office for Victims of Crime for its support of this SNAP's webinar program. So here are the learning objectives for today's program. You will learn in this SNAP's webinar about the value of understanding the composition of your community and the challenges it could present in preparing for a mass violence response. How this information can enhance response plans, who and what should be considered in developing the plan for the most survivor-centered response. A mass violence response is ultimately about serving the people in your community who are both directly and indirectly impacted by the incident. Planning an effective victim-centered response to a mass violence incident starts with first knowing your community. Mass violence incidents can occur anywhere at any time to any population. Having a clear understanding of who is part of this community and any specific needs they may have will make any response more efficient and effective. Well, why is this important? A mass violence incident can easily and quickly overwhelm resources and services, and it is critical that everyone affected feels safe, secure, understood, can communicate and receive communications, and access services that are appropriate for them. A mass violence incident does not impact everyone in the same way. Age, language, disability, and socioeconomic status can shape what survivors and families need in the first minutes, weeks, and months ahead. Knowing your community allows you to design services that address their specific needs. Demographics can drive every operational decision you make in a mass violence incident. This may include the size and capacity of the Friends and Relatives Center and the Family Assistance Center, interpretation services, reunification procedures for survivors and their families, transportation planning, and behavioral and mental health resources. This ensures that planning is realistic and not theoretical. Consider how important communications are after an MVI. They must reach everyone. For example, certain populations may need alerts and updates translated. Older adults may rely on radio and television rather than social media. And youth and college students may rely on texts, social media, and campus systems. All the information being distributed must be consistent, correct, and transparent for all, but distributed in a way that reaches everyone in a meaningful way. Planning for this will prevent miscommunication, rumors, and false information, and build trust. So what does this mean for those who are working on preparedness plans? First, it's critical to understand the demographics of the community, including overall population, age distribution, socioeconomic status, employment, spoken languages, faith communities, vulnerable populations such as those in nursing homes, group homes, the unhoused, and people with mobility, visual, cognitive, and hearing challenges. A victim-centered response is that which considers the specific needs that all community members may have that could impair their access to safety and services. One example of the importance of understanding the needs of a particular community is Lewiston, Maine, where the deaf and hard of hearing community was directly impacted by the mass shootings on October 25th of 2023. Some survivors and families said that there were epic communication failures and barriers in the immediate aftermath, including at the scenes, hospitals, the Friends and Relatives Centers, and this compounded their trauma. There was a lack of ASL interpreters and unreliable video remote interpreting services used by responders that were not adequate for communication. The consequence was that communication was difficult, family members did not learn information for hours, and initial media briefings even lacked ASL interpretation. Understanding the demographics and needs of a community before an MVI occurs will alleviate many of these problems and provide the quality services victims will need and deserve. Another factor to consider are those potential victims who interact with the community and could be impacted by an MVI but are not permanent members of the community. This may include tourists, commuters, seasonal workers, students, and other transient populations. This can impact services such as housing, travel, victim assistance, and behavioral mental health services, in addition to the needs of local community members. With thoughtful planning about all community demographics, responders will be in a much better position to have services available no matter who is impacted. At the Friends and Relatives Center and then the Family Assistance Center, you will be ready to welcome all of those who were impacted, notwithstanding their needs. This must include ADA compliance with the location and physical layout, and can include language access, quiet rooms, and separate low stimulation environments, accessible transportation, communication aids and signage, and medical and other functional support. In closing, we hope that the information provided in this SNAPS webinar was helpful to you. Please let us know your thoughts about this program or provide us ideas for future ones. If you have any questions, please do not hesitate to contact us at the National Mass Violence Center. All SNAPS webinars are posted on our website at nmvvrc.org and icptta.com. Thank you so much for your participation in this MVI SNAPS webinar.